Hi, my name is Keith Stallworth. I'm an actor, filmmaker based out of Los Angeles. I was diagnosed with gastrointestinal reflux disease resulting from a hiatal hernia, discovered in a couple of scans of my abdomen back in 2011. But it's not till now, April 2023, that I can say I've truly been treated for either the hernia or the resulting disease. Following the original diagnosis, I tried all the treatment plans available to me, everything from the exercises to pull the hernia down to antacids and the pillows, lifestyle changes. After about a decade of that, I just wasn't getting any better. For 2023, I decided I just really needed to try something different. As a matter of fact, as of January 2023, my symptoms were so bad, I was fairly certain I was going to need surgery to fix this. With the help of a friend, I was able to get a video conference with a gastroenterologist I found on this app called Practo, Dr Marutrhesh Gowda, who is an absolute boss, by the way. Not only is a guy a gastroenterologist, but he's also a practicing laparoscopic surgeon. So if I could just talk to him, I would at least get some questions answered as to whether or not surgery would even fix my problem. And the very first thing he did was listen, which was great. I did a lot of talking. I told him, I'm fairly certain I'm going to need surgery for this. He seemed skeptical that I could know that with any kind of certainty at all, but he agreed we should meet and he'd take a look. So I flew to India. We met at his office, we sat, we talked, and he told me, frankly, he wouldn't just do a procedure on me. He wouldn't do anything at all unless he was absolutely sure it would help. But we agreed to do an endoscopy so that at the very least, he'd have a full report. He did the endoscopy. The results came back in less than 15 minutes, at which point he showed me everything he found and agreed that hernia was indeed becoming an issue he felt fairly confident he could address, which just hearing him say that was pretty cool. He recommended I proceed under his care with the Nissen fundoplication, which would deal with the hernia, the GERD symptoms, as well as some esophagitis and weakened lower esophageal sphincter. He laid out everything I should expect from the surgery in a very clear, concise, easy to understand way. And in the end, it just all made sense. 7 p.m. that evening, I checked into Manipal Hospital, the Ball. The next day, he performed the procedure. The day after that, I was home, recovering in my apartment. I'm now 11 days post-op, no pain, post-op meds, ibuprofen. That's it. I've got a couple of surgical scars, 5 of them, actually. Those were pretty sore first few days. But I feel great. I do have still a little bit of tightness in my throat. My stomach is still getting used to the changes. My stomach is definitely a little smaller. I'm still on soft foods here for another few days. And symptoms gone. No more sleep regurgitation at all. No more bending over and feeling like food is going to shoot up into my throat. I haven't taken an antacid since the surgery. The symptoms did get a bit worse the first few days, the first 5 days, which he said I should expect. But as of now, 11 days out, I feel great. I've got about another 4 weeks till I'm back to my full routine. But as far as I can tell, the surgery was a success. And last thing I would say is just that if you're a patient of Dr. Gowda's or you're thinking about going under his care, whether you need surgery or not, or it's something else, don't worry. You're in good hands.